Hello and welcome back to T1D Academy. I'm Harold, your host, and as always, Liam and I are really glad that you're spending a few minutes with us today. This episode tackles one of those early topics that often serves as a point of great confusion for most people when they are first diagnosed with type 1 diabetes. It's a term that often gets mentioned fairly early after diagnosis because at that time it is highly relevant. But it's often thrown into the mixer with all the other knowledge that's being downloaded into your brain during your initial hospital stay. Then once you're discharged and you're back home, you may not remember much, if anything at all, about this particular topic. Because you learned so much during those first few days in the hospital. So the purpose of this video is to walk you through it slowly and deliberately and make it extremely clear so that you can fully understand what it is. What topic am I referring to? You might have guessed it. The honeymoon phase, of course. So after diagnosis, many people experience a period of time where insulin needs may begin to decrease because the body is still producing some of its own insulin. That period is what's known as the honeymoon phase. The honeymoon phase is a temporary period after diagnosis when the body is still producing a small amount of its own insulin. It's not enough to manage blood sugar independently, and it's not enough to eliminate the need for insulin therapy, but it is enough to reduce how much insulin is needed from injections or a pump. To understand why this happens, we need to briefly rewind. As you recall, type 1 diabetes develops because the immune system attacks the insulin-producing beta cells within the pancreas. But at diagnosis, those are not usually completely destroyed or gone. Many are damaged, many are struggling, but some are still functioning. Before treatment begins, blood sugar levels often are extremely high because over time, glucose has built up in the bloodstream due to there not being enough insulin to properly move that glucose into the cells where they can be used as fuel. And that high glucose environment puts enormous strain on the body. When insulin therapy starts and blood sugars come down, that strain decreases. In that improved environment, the remaining beta cells sometimes function a little better for a while. And that temporary production of insulin is known, again, as the honeymoon phase. Now let's talk about what this can actually look like and what it can actually feel like in real life. For some people, the honeymoon phase can make blood sugars feel steadier, and they may find that they can scale way back on their external insulin requirements. But for others, and this was certainly true in our case, it can feel like the exact opposite. When we were following a specific set of insulin to carb ratios known as IC ratios, basal rates, correction factor settings, etc., all given to us by the hospital staff and the endocrinologist, and then you suddenly have the pancreas also contributing insulin, it can cause unexpected lows. You dose for what you think is needed, and then the body decides to add more, which can wreak havoc in small bodies such as our son Liam's when he was diagnosed at the age of 2. In our case, as I state, I believe this was especially true because of Liam's age and size at diagnosis. He was only 2 years of age, basically still a baby, and at that size, even a tiny additional amount of insulin, something like 0.05 units, could cause his blood glucose to crash. And we experienced those a lot. So when his pancreas would unpredictably contribute its own insulin on top of what we had already dosed based on what the doctors had recommended and stipulated, those lows quickly happened without much warning. That made those early months feel extremely unpredictable and, quite frankly, exhausting. In our experience, the honeymoon phase was not easier, it was more stressful. It was a lot of second guessing. It was adjusting settings over and over because there was another insulin source which we could not see, nor could we measure directly or account for. Ironically for us, once the pancreas stopped producing insulin altogether, management felt more straightforward and easier in our use case. We could trust that the settings we had configured were going to help manage his blood glucose correctly, because we knew the only insulin in play was the insulin that we were administering through either syringes or the pump. Aside from, of course, the normal liver glucose releases. There were no surprise contributions once the pancreas discontinued producing insulin itself. So if you or your child is experiencing the honeymoon phase right now, and it's 2:30 in the morning, and you're up because you or your small child had a low that you had to wake up to treat, and you can't sleep anymore. So you're perusing the internet and watching YouTube videos to learn more about this phenomenon, and you somehow made your way to my channel, just know that it gets easier. Just persevere through this stage for a little while longer, and more stability will exist for you. Don't beat yourself up. I was the worst offender for this. My wife can attest to that. For the first couple of years, possibly, I was very OCD about my son's management of his type 1 diabetes. I constantly banged my head against the wall, cried, cursed, and every emotion under the sun, because I felt like I was failing Liam. But during those months, I was doing my best that I could, given my inability to know or predict what the pancreas was going to do at any given moment. During those early months, my recommendation to you is that if you are enduring this now, and again, if you're up at 2:30 in the morning watching this video, is just to realize that things will get better. Things will get easier. Management will always be required, but you'll get to a place where settings will mean more once you're past the honeymoon phase. And if you're looking at our night screen window now over on my other monitor, which I haven't even gone to yet, but if you're seeing the ups and downs there, you will see those frequently due to the age that he's in now with hormones and teenage years around the corner, and also technology never being perfect. But just know that what you're seeing on the screen is as well managed as we can get at this point, and we're okay with that. And that's what I want you to understand with the honeymoon phase. Just do your best, persevere, and realize that you're doing your best. You learn, you grow, you fail, you succeed. That's what you should take away from this. Be proud of the fact that you're awake at 2:30 in the morning, concerned about you or your child's health. Be proud of what you've learned so far and all that you're trying to learn. It's all about learning every day and failing until you eventually succeed. If you're up at 2:30 because of the honeymoon phase, just know that you're going to make it through this and you'll be stronger for it. You're doing an amazing job. Now, medically speaking, you may also hear the honeymoon phase referred to as partial remission. Partial remission in type 1 diabetes is this temporary period shortly after diagnosis where the remaining pancreatic beta cells, helped by the fact that blood sugars are now better controlled and no longer toxic to the system, produce enough insulin to significantly lower the need for external insulin. It's not full recovery, it's not a reversal, it's partial, and again, I want to emphasize it's temporary. Clinically, this phase simply means that the insulin needs drop while blood sugar remains in a healthy range. Doctors may recognize it because doses are lower than expected for someone newly diagnosed. About half of children and a little more than half of adults experience some version of the honeymoon phase following diagnosis. During this stage, close monitoring is important because insulin needs can quickly change, sometimes unpredictably. Adjustments are normal during this time. As I previously stated, the honeymoon phase is temporary. For some people, it lasts for a few weeks. For others, it can extend for several months, and occasionally, it can even approach a year or longer. There is no guaranteed timeline, and there is no reliable way to force it to last or to make it go away. Eventually, insulin needs begin to rise again as the remaining beta cells decline further, and eventually disappearing. When that shift occurs, management simply changes because this is the natural progression of type 1 diabetes. For kids and teens watching this, here's the simplest way to think about it. Your pancreas is supposed to help make insulin. With type 1 diabetes, your immune system has been interfering with that job. When you first start insulin treatment, sometimes your pancreas can still help a little bit for a little while. That help can be inconsistent, and that's why numbers might feel confusing and frustrating for a while. And that naturally segues into the next topic in this hospital stay following diagnosis series. If you're going to be given insulin long-term, which everyone diagnosed with type 1 diabetes will be doing at some point, it's important to understand how basal insulin and how bolus insulins work, whether that's delivered separately as injections or through two different types of insulin, or whether it's through a pump where you use a single type of insulin, filling the job of both types of insulin. In the next video, we're going to walk through what basal insulin is, what it does, what it's used for, and how it works together with your basal insulin in everyday management. Before wrapping up, and as the normal disclosure, the content on the T1D Academy YouTube channel is for informational purposes only and should not be interpreted as medical advice. I am not a doctor, nor am I a healthcare provider. Everything shared on my channel, on mine and my son's channel, is based on lived experience and personal perspectives only. Please consult with a professional, a qualified medical professional for diagnosis, treatment, and individualized medical advice. Until the next video, take care of yourselves and take care of each other, and remember, you've got this. And as always, Liam, 143AI +1. Thank you much and have a good day.